everyone. Good morning or good afternoon, depending on where in the world you're joining us from. And thanks for hopping onto today's exciting webinar. It's a global COVID-19 update, lessons learned. My name's Amy. I'm a member of the marketing team at Perry Johnson Registrar's Food Safety, Inc., and I'll just be helping to facilitate today's session. We're really excited to be welcoming back Dr. William Lee of the Angiogenesis Foundation for another webinar on the topic of COVID, and I will be introducing him to you a little further into the presentation. Just before we get started, I have a few housekeeping notes to take care of. To ensure audio quality, all attendees on the call are muted, but we do absolutely want to take all of your questions. So if you have any thoughts or want any clarification on anything that Dr. Lee has to say regarding the topic, please go ahead and open the questions tab on your control panel and type those questions in, and we will respond to as many of them as possible at the end of the prepared presentation. This is just to show you what the questions tab should look like on your screen. The number one question we usually get is, will there be a recording or will the slides be available? And the answer to both of those questions is yes. Both the slides and the recording will be available in about 24 to 48 hours from the PJRFSI website at www.pjrfsi.com. And without further ado, I want to go ahead and introduce our very first speaker here, just briefly, Paul Demarin, our Senior Vice President of Food Safety and Supply Chain at PJRFSI. He joined us in January this year, and with over 35 years of experience in the hospitality, service, and retail agri-food sectors, Paul has been a huge player in really helping us get all these webinars off the ground, so we're super appreciative for him. Before he came to PJRFSI, Paul worked for 15 years in the certification industry with clients in sectors from food safety and supply chain to brand protection, automotive, aerospace, really a little bit of everything. And then before he was in the certification industry, Paul was a professional chef and consultant for over 20 years, working in major hotel chains, restaurants, private golf courses, and food service organizations. So I'm going to go ahead and hand things over to Paul, and Paul, you can take it away when you're ready.
Great, thank you very much, Amy. Thank you so much to everyone for joining our webinar today. I really appreciate your time. As Amy mentioned, my name is Paul. I'm the SVP here at Perry Johnson Food Safety. We're honored and thrilled to once again welcome our friend Dr. William Lee. Back in May of this year, Dr. Lee and PJRFSI hosted a webinar on boosting your immune system during COVID. We had over 3,000 companies that had registered for the webinar, and we're very similar today as well. So during the session today, Dr. Lee's going to talk about what's really been happening in the world since May, what we've learned about the virus, any sort of key insights on his own research that he's been doing around the virus, along with information on the article in the New England Journal of Medicine and recently the op-ed in the Washington Post. He's going to talk about what we can do to continue to protect ourselves and place the right focus on our health moving forward. So just before we do that, I'm just going to talk for about a minute and a half just on who we are as a company so you understand that. We're a global certification body. We were originally founded in 1994 by Perry Johnson himself, and we've been at the forefront of international certification and registration from the very beginning, really going across every sector. We achieved various accreditations over the years. Our first venture into international business came in 1999, where we expanded to Japan and Brazil. PJLA is our laboratory accreditation business, and that was founded in 1999 as well. We had acquired additional organizations and UCAS accreditation, as well as continued to expand into the United Kingdom and China during that time. In 2005, we founded a company, PJNA, which is a healthcare technology company that specializes in transcription, medical coding, and telemedicine. And then shortly after that is where PJRFSI was born in 2012 as a result for the demand of registration, testing, and certification in the world of food safety. So we have global offices around the world in about 60 countries. We're conducting work right now. We do auditing, everything from food safety to organic certification, gluten-free, social responsibility, and many others. Our services that we have are really defined into 4 key areas: auditing and certification to third-party accredited standards that are recognized around the world. We have programs that we've developed ourselves, like good manufacturing practices, good distribution practices, et cetera, from a second-party perspective. We work with a lot of customers on conducting their own first-party audit. So if you think about a company like McDonald's, they have an audit that every one of their suppliers around the world have to go through before they can even supply to McDonald's. We're recognized as a global provider there to support that. So we work, as I mentioned, with companies in virtually every sector across the industry, from distribution to aerospace to food safety and medical. We apply the principles of quality management and organizational excellence with all of our audit and field activities. We have about 1,000 auditors in 60 countries who understand the language, the culture, and the requirements or regulatory requirements as well. So at this point, I am going to cut my part short because I want to give us as much time here for the star of the show, Dr. William Lee. And I will, at this point, pass it back to Amy. And again, Dr. Lee, for your time today.
Great, Paul, thank you so much. As Paul said, we are very excited to be welcoming back Dr. William Lee for another webinar on COVID. So Dr. William Lee, if anyone has never heard of him before, is a world-renowned physician, scientist, speaker, and the author of Eat to Beat Disease, the new science of how your body can heal itself. He's best known for leading the Angiogenesis Foundation, and his groundbreaking work has impacted more than 70 diseases, including cancer, diabetes, blindness, heart disease, and obesity. His TED Talk, Can We Eat to Starve Cancer?, has garnered more than 11 million views, and he's appeared on Good Morning America, CNN, MSNBC, NPR, Voice of America, as well as in The Atlantic, Time, and The New York Times. An author of over 100 scientific publications in leading journals such as Science, the New England Journal of Medicine, and The Lancet, Dr. Lee has served on the faculties of Harvard Medical School, Tufts University, and Dartmouth Medical School. It's now my great pleasure to hand things over to Dr. Lee. So, Doctor, whenever you're ready, please go ahead and take us away.
Well, thank you very much. It's a pleasure to be speaking again to this organization. So much in our world has changed and is still changing as we talk about what is happening with regard to our public health and really our daily lives. So I wanted to kind of give you a little bit of a view on the world that we've now grown into since May, and a little bit of a clue of what lies ahead. So I can actually have the first slide. Great, and the next one. So, you know, these are some of the questions that I know many of you have. I know that I've had them myself, which is, you know, what are the issues that actually concern us that we have to be careful about, and how do we actually find a trusted voice to be able to tell us what to do, what to believe, and how to navigate as our lives enter the fall and go into the winter. And as we're looking ahead, you know, many of the things that stymied us in the spring now have actually gone on to evolve into more normalcy to some extent, but we still have in the back of our minds questions about them. So the first thing I want to talk about have to do with, you know, airborne viruses and surfaces. If I could have the next slide, please. So this is really one of the things that we're all concerned about, right? So at the in the spring, when we actually were getting our mail, we were scrubbing it down and spraying it down, and when we brought back our groceries, we were wiping off, you know, everything, trying to make things as clean as possible, and that took a huge amount of effort. I know it did for me. And we started to hear things like this virus could survive in surfaces, and metal was better than cardboard, and that it could survive up to 3 days. And off of a cruise ship, they found they could survive 21 days. And so really there was a lot of confusion about surfaces. And then the other thing we learned was that it's in the air and it comes out in respiratory droplets. But we were starting to hear about air conditioners in restaurants blowing the virus around. And so I want to actually kind of tell you that surfaces turn out to be okay. We don't really need to wipe down everything because this virus is actually kind of wimpy, the coronavirus, in outside in warm temperatures. It doesn't stick around very long. And what we're now realizing is when you test actual surfaces, or frankly even human samples, that the concentration of the virus makes a big difference. And Things that have been left outside, by the time the mailman or the FedEx person drops off something, if you leave it out there for a few hours, it's almost certain that if there were any viruses that happen to have been deposited on there, they're probably not going to cause a problem. So I think if you you don't need to actually go and wipe down everything spotlessly like we used to, but we do have to be concerned about how the virus spreads from person to person. And what we do now know is that it is actually airborne. Now, let me explain airborne to you a little bit. So respiratory droplets are, you know, the old thing that you talk to somebody who, when they're talking, they're spitting or coughing and they've got drops everywhere. That's a respiratory droplet. Those things kind of travel maybe 3 feet and then they kind of drop down. And that's where this whole 3 to 6 feet kind of social distancing idea came from. But we do know that this virus actually seems to be able to actually go into finer droplets that hang around in the air. And the best way to think about that is, you know, back in the day when people were smoking, right? So they would actually exhale and the smoke would linger in the air. Even if they weren't breathing it directly to your face, you could still even see the smoke hanging in there. Or another way to think about it is if you strike a match and you blow it out, you'll see the smoke puff going out there. Well, that smoke, if you're a good distance away, has become airborne, aerosolized. That's different than a respiratory droplet. Sort of think about respiratory droplets as kind of like rainfall. Aerosolized is sort of the things that hang in the air, the candle that you smell from the other end of the room. And this is actually something we need to pay attention to, because that tells you that distance matters from a social distancing perspective. And it also tells you that masks matter, because if you can't breathe in those airborne particles or the respiratory droplets, you are actually protected. And if I could have the next slide, I want to show you a study that actually was done by Duke University and published recently, looking at the effectiveness of face masks to actually prevent droplets from getting out. And what they did, next slide, is really interesting. They actually measured a whole bunch of different types of masks. If I could have the next slide. And these are the masks that you've actually seen before. You got your procedure masks, you've got your cotton masks, you've got, you know, your N95s, you've got your bandana, you've got your neck gaiter. That's the one in number 11 that you're seeing there, the one that actually, you know, that you see many people wearing. And what was interesting is that this study asked, what's the best mask and what's the worst mask? And here you can actually see the data. So on the vertical axis is actually the drops that come out of them that can be detected. And you can kind of see on the far right in the green dot right here, this is no mask, okay? These are the drops that are coming out, and it's all normalized to the drops coming out if you're not wearing a mask. And what was really interesting is that the N95 mask, which is reserved for healthcare workers still, is the best mask if you compare them all. And that's not surprising. That's what is used in the hospital. Next, you can see the surgical mask is actually pretty good. Those are the procedure masks that your dental hygienists wear. They're lightweight. You stick them around the ears. You see people wearing them. Those are actually pretty good. And the cotton poly masks are also pretty good. Those are the ones that you can make at home or you can buy on the internet. The key is that they're not single layers. They're a couple, 2, 3 layers is best, but 2 layers is also just as good. All these different cotton ones are actually pretty decent. But here's the surprise, and I think this is one of the take homes from this learning I want to tell you. Look at this. This is the gaiter, the fleece gaiter they call it. This is the neck gaiter. It is worse than actually not wearing a mask at all. Let me repeat that. The neck gaiter that we see people wearing around is worse than not wearing a mask at all. And that's something about the shape of the gaiter actually allows those respiratory droplets to become finer and then sprays out those fine droplets. Worse than if you actually didn't have a mask, wear a mask at all. And then second worse is actually the bandana, okay? It's better than nothing, but really not that great. And so what's the take home on this is that we now know that it is important to wear a mask. That's important because not just of the 6 feet rule is for social distancing, but also to protect yourself from the aerosolized particles, because this is one of the ways this virus can spread, and that not all masks were created equal, and that don't bother trying to find N95 masks. Those are still really hard to find, and healthcare workers should stay with them. Cotton, polycotton masks are fine as long as they've got 2 or 3 layers. But if you see someone wearing a gaiter, don't wear a gaiter. And let's say on the next slide, don't wear a bandana. those are the no-nos, okay? And if you see somebody wearing with them, go in the other direction, because they might actually be a danger to the people around you. So this is, if there's one thing I can actually leave you with from a practical tip, it's going to be about these masks. And I have the next slide, please. So the other thing that was really interesting that's changed since the spring, I know that when I, as a doctor, first started to look at the information about the pandemic, and patients were asking me, what I was telling them was that, this is a virus that actually affects the elderly primarily, and people with underlying conditions like diabetes and heart disease and other types of infirmities. And we actually thought that for quite a long time, I would say until about the beginning of the summer. And then over the course of the summer, and now that school is coming back, and we know for sure that young people without any underlying conditions can actually develop COVID. They can be infected. They may be asymptomatic, which in a way is even more sneaky, because they're not even looking like they're sick, and they can spread it to other people. And so this is not a disease of older people. This is a disease that can affect young people. And as of September 2020, most of the people getting COVID are young people. So there's been a shift in the population who's getting it. More young people are getting it now than older people. Now, partly it's because older people are actually still quite careful because of all the messaging that's been out there about how careful, how vulnerable they are. And young people still feel like they're invincible, but now they're getting back to school. So another thing that's changed about since May is our realization this is not just a young person's disease. This is also an old person's disease. It's also a young person's disease. And the other thing that we used to think in the spring is that this is a respiratory virus that causes a lung disease. We now know that this is a lot more than a lung disease. And I want to tell you about some work that I've actually done that's actually uncovered, the research I've done has uncovered what it actually does in the body, both in the lung and outside of the lung. I can have the next slide. So one thing that we did is we actually were able to obtain tissue from people who actually had died of severe COVID. These are unfortunate people, and we were able to get the autopsy tissue. And we started to look inside the lungs to figure out what was happening. And what we've discovered was astounding. We discovered that while this respiratory virus does invade the lung and does cause an infection of the lung, the virus makes a beeline for the blood vessels in your lung and infects the blood vessels. And when blood vessels are infected, they can become clotty, which is a problem that we've been seeing, the clots in the lung, and they can also spread to the brain and the heart and elsewhere in the body. So take a look at these pictures from my research. On the left is a picture of blood vessels in a normal, healthy lung. So presumably everybody on this webinar has a lung that looks like this. These are the blood vessels. They look like beautiful lace. It's kind of like what you would actually put on a beautiful tablecloth. And each of these vessels is wrapped around an air sac, which is how oxygen gets actually into our bloodstream to be delivered to our organs. On the right is a lung that's been infected by COVID. I don't have to describe this to you. You can kind of see that COVID has wrecked, trashed the blood vessels in the lung. And we believe that this is one of the reasons that we saw all these problems in people in the springtime that couldn't be explained because they couldn't be rescued by the ventilator very easily. They were having really bad lung problems. And now we know that this is a vascular disease as well as a lung disease. Okay, so this isn't a lung, I'm telling you, but I told you this is more than the lung. We've now realized that COVID can actually affect other organs like the heart. So there was a study recently done out of Germany that looked at 100 patients. Most of them were younger, that weren't even in the hospital. They weren't even seriously sick. And they found in 100 patients who had recovered from COVID that almost 80% of them actually had some residual damage in their heart, and you could measure this damage. So we actually took a look in other organs in the heart as well, and I want to show you what happens in severe COVID in the heart. On the left are the blood vessels in a normal heart. Now these are going left to right, so think about the heart is tipped on its side. You can imagine the heart muscle squeezing down and pumping blood through each of these beautiful pencil-like blood vessels. They're actually just between the layers of the heart pumping down, and that's what your heart and my heart would all look like on this webinar. But look on the right what happens with COVID. When the virus goes in from the lung into the blood vessels and affects the heart, it trashes the blood vessels in the heart as well. And we're beginning to hear about this new syndrome that's occurring that actually affects heart rate, heart inflammation, all kinds of problems that we're actually seeing out there. That's a problem. So this is, if I need to give you another reason to keep your distance and wear a proper mask, I wanted you to remember this picture, because this is not just in your lung. This is in your heart, and this is actually the kind of thing that we're really concerned about, that we don't want to actually get. So this is not a condition you want to like, let's just get it over, let's get it and get it over with. This is something you want to, this is an infection you want to avoid at all costs. Next slide, please. So the other thing we're beginning to learn is that there are long-term effects. So in the spring, most of the people who got COVID who didn't need to go into the hospital, or who were sick but then came out of the hospital, they got sick, kind of like a bad lung infection, kind of a pneumonia-like, maybe for a couple of weeks, and then they would bounce back. Most of the people would actually bounce back. And now we're starting to realize something very different, because we are now, 8 months into this pandemic, and we're realizing that people who are infected in March, and who may even have recovered fully, apparently, months later, they're cropping up with really odd, bad symptoms. What are these symptoms? Well, we can't yet explain them, except that we think they're related to the vascular damage to the blood vessels. Their hair is falling out in clumps, and it's not stopping. Their heart is racing out of control, even when they're not moving. They're having terrible brain fog, and they've got inflammation in their brain. They can't remember things. They can't focus. They're having muscle weakness. So young athletes, football players, in colleges who are recovering from COVID are not only unable to get back on the field, they're unable to walk up a flight of steps. Now, this isn't everybody. Not everybody actually comes down with this, but we're beginning to see this new phenomenon that we're calling long hauler syndrome. If you look that up on the internet, you'll see what this is. There's actually a group called Survivor Corps that's gathered together more than 100,000 people that are suffering from this condition, this disease, second to COVID, doesn't even have a formal medical name yet. It's not in the textbooks, not even in the research literature, but patients are coming out of the woodwork talking about how some of them have not recovered from COVID, and they are debilitated. They are disabled. They can't go to work. I've been talking to people who are singers, who have lost their hearing. Weird phenomena like glaucoma suddenly popping up in people's eyes. These are somewhat frightening effects, and we don't know who's most vulnerable for this. So again, I go back to this thing: wear a mask. You don't want to get infected. Keep your distance. There is a vaccine that's coming. So if I could have the next slide. And this is just an example of something I've been talking about, talking to patients. This is Shelby Hedgecock. She's actually a fitness trainer in Los Angeles, and she's gone public with her story. Chris Cuomo himself actually has long hauler syndrome, and so they've invited me on actually to try to provide a medical view on this. So the good news is that researchers are beginning to work on this, and so we're on it. But we're just at the beginning of this tip of the iceberg, and we're realizing this is not an infection that you want to get over with, because some people are not getting over it. Next slide. All right, so now that I've told you some of the things that we've learned since the spring, let me now give you some practical ways of thinking about what we can do for ourselves, whether it's COVID or not. But we, especially given the fact that we're not done with this pandemic, what can we do to actually protect our interests? And this is where food as medicine and what we eat can actually help our health. So I can have the next slide. I want to talk first of all, I showed you about the damage that COVID can do to our blood vessels. Well, it turns out that this kind of damage probably is more common than we thought, but we haven't looked for it. And so what's interesting about my research is really diving in to take a look at foods that can actually help our body's stem cells stimulate regenerative healing. So if I can have the next slide, I'll tell you what some of these foods actually are. Now, why am I showing you starfish? Is because when we were kids, we were taught that starfish and salamanders can regenerate and people can't. Well, that playbook's been actually thrown out, and there's a new chapter that's being written. We know we can regenerate. So I want to give you just a few foods that actually you can eat that actually stimulate your body's own stem cells They will come out of your bone marrow where the stem cells normally live. Think about bees coming out of a hive attracted by the beautiful flower bed, and they will actually help to repair your body from the inside out. The first one is dark chocolate, and I think that's most people's favorite. The good news is that dark chocolate, cacao, has these flavonols that actually mobilize, recruit stem cells out of our bone marrow. And there was one research study where actually having dark chocolate in the form of hot chocolate actually doubled the number of stem cells in the bone marrow of patients who already had heart disease, and it improved their blood flow. So better circulation, better repair. Dark chocolate, who doesn't like dark chocolate, is sort of that's a piece of good news. Now, another thing that actually has been shown to actually repair blood vessels and help to regenerate is, in fact, omega-3 fatty acids from oily fish. Everybody talks about salmon, and I'm probably like you. I get bored with salmon all the time. What's another fish that actually has a good amount of healthy oils, marine omega-3 fatty acids, is sea bass. A lot of different kinds of sea bass. You got your branzino, you got your Mediterranean sea bass. Back in the day when we were going out to restaurants, you would see this frequently in a menu, but you can actually go to your grocery store if there's a seafood section and look for sea bass, or you can look for it frozen. And just eating 3 to 6 ounces of sea bass, that's about the amount of in a deck of playing cards you could fit in your palm, is enough to give you some healthy omega-3s that your body needs to get your stem cells to come out. Next thing is actually black chokeberry. I don't know if you guys have heard about this, but another name for it is aronia berry. This is actually a kind of a blueberry-like looking thing, fruit. It's got a little bit more tang to it. It's delicious. You can find it frozen in places. Sometimes they have them in the health food store. They have aronia powder. It's also called black chokeberry, which is how you might look it up on the internet to find it. This has actually been studied in humans and shown that if you mix the aronia berry over and drink it like as a shake or a smoothie, and that's a great way to actually put it into a morning shake, you can actually also get stem cells to come out to help repair yourself from the inside out. So anybody's ever interested in slowing down aging, this is actually a way to do it. Turmeric, which is a spice, a lot of different benefits, not only helps your mind to feel less depressed, and we've all felt the doldrums from being locked down at home and not being able to see our friends the way we want, but it also stimulates stem cells out of our bone marrow. And so that's another benefit of having a curry, or actually putting some turmeric, even in coffee. They've got actually turmeric you can actually put in. And then black tea, is interesting because we've always known about the benefits of green tea, which I love. And I drink every day, but black tea has always been thought, well, that's English breakfast tea. It's oxidized, and so it doesn't have a lot of the good stuff. When it comes to stem cells, black tea actually helps attract stem cells and put them into your, naturally, when you drink the black tea, the stem cells come out into your bloodstream and actually can help affect repair in your body as well. So, as we get into the fall, we go to the holiday season. If you want to kind of like reboot yourself to prepare to be as strong as you can getting into the winter, that is actually something you can get. So, but let's talk about immunity as well. Immunity is really important. And, I think in the spring, I showed you guys some foods that you can actually get in the spring and summer. Well, I like to eat seasonally, so let me share with you some fall foods, if I can have the next slide. Here's a group of fall foods that people love that actually can boost your immunity. Cranberries, we're heading towards the bird day, and Thanksgiving wouldn't be what it is without having cranberries. Making cranberry sauce is actually a wonderful way to actually get the anthocyanins, the natural chemicals in cranberries that bring out our delta gamma T cells. These are part of our immune system. So our immune systems, think about it like as an army of super soldiers, and one of the different super soldiers types is called the delta gamma T cells. Cranberries actually bring them right out. Those are first responders to help intercept viruses that might be around. By the way, not just coronavirus, but other viruses that might be around. Pecans filled with fiber, and this fiber feeds our gut microbiome, our healthy gut bacteria, which boosts our immune system. And eating pecans is a great way of actually getting fibers. I actually personally really love pecans. And in the fall, I can think of all kinds of things to cook and bake with pecans. As we get into the winter, deeper in the fall, mandarins and oranges become in season. And it turns out that vitamin C is a very important component of actually keeping our immunity up. It actually helps our immune responses happen a lot faster. It helps build the cells that actually produce antibodies. These are natural antibodies against infection to come out. So think about, your fresh squeezed orange juice. Think about just eating slices of mandarin, could be clementine, could be juicing oranges, a lot of different ways. Sometimes I bake with oranges. If you're actually roasting something, and orange is a nice way of actually getting some flavor as well. I like to cook, and I think that if you're going to talk about healthy food, think about it in ways that actually are delicious. You can slice them into a salad would be a great way of using it as well. And then fall mushrooms, white button mushrooms, portobello, hen of the woods, maitake, shiitake mushrooms. We're starting to see these mushrooms, and as you get into the winter, you can get dried mushrooms. These mushrooms have a type of fiber called beta-glucan, and this beta-glucan, this natural chemical, a fiber, feeds our gut microbiome and makes our immune system produce antibodies that's in our saliva and also in our mucus in our nose, and that protects us against infection as well. I love mushrooms. You can slice them up into a salad. You can saute them. You can bake with them. A lot of different things. Put them into a stew. You can make a soup out of them. Super easy way of actually getting variety. And they go really well with different spices and herbs. And yogurt is a fermented food that's actually really good for feeding our microbiome. And again, our healthy gut bacteria loves yogurt. A great way to start the day is actually to feed our bacteria along the same way, and that also boosts our immune system. So these were just some things that you can eat going into the fall that you can eat breakfast, lunch, or dinner. It doesn't need to be a special occasion, doesn't need to be the holidays, but just something to kind of put these arrows in your quiver as you're thinking about how to actually make healthy choices. When we go to the grocery store or the farmer's market now, nobody's browsing and hanging around a long time. We're kind of going out and seeing something we want to pick up that's good for us and then taking it back to our homes. If I can have the next slide. So, I've just given you like 10 foods that are good for your health, but I wrote this book called Eat to Beat Disease that contains lists of more than 200 foods. And I'm absolutely confident that it includes foods that you love. And so one of the things I wanted to do is to write a book about healthy foods that you don't have to run away from or glaze over and say, please, not another kind of treatment about kale or whatever else it is, although kale is healthy. Here's 200 foods that figure across all kinds of categories and all kinds of cultural genres that you can actually go in there and figure out how to order, how to cook, how to eat. And you can get this book anywhere books are sold online and in bookstores. Next slide, please. So how do we plan for the future? Here's my take-home message for you. Wear a mask, keep your distance, wash your hands. This is the best way to prevent getting the virus that can damage your body in ways that we didn't think before that we're beginning to realize now. That's number one. Number two, outdoors, when the weather is still good, use your time outdoors. I happen to love the fall. I live in New England. The summer's great, spring is great, but I love the fall, that crisp air. Spend time outdoors. Now, if you're living in places with fires and smoke, obviously you're forced to be inside for safety. But when you can get out to the outdoors, now's the time to take a walk, go for a hike, spend some time just relaxing outdoors. Keep that outdoor furniture out a little bit longer and try to enjoy it. Avoid crowds. We're still cautious, really cautious about being where there's too many people. By the way, this is true even for flu season. And a lot of the things that we're learning now, we're going to keep forever because they actually help us avoid getting the flu in the wintertime. Right now, we're still not traveling massively. There's a couple of research papers that just came out, studies that show that, in fact, people can get COVID flying in airplanes. So we still want to be careful, although I think airlines are doing a really good job now. But, if you need to travel for work or for family for some critical reason, by all means, take your precautions and get on a plane and go. But otherwise, be very, very careful traveling. I'm not getting on a plane just yet. And then finally, there's something I can actually recommend that you do that is, as a doctor, I tell everybody at this time of the year, just get your flu shot. The flu shot will lower your risk of getting a flu, which then lowers your, makes you more vulnerable to get other infections. And nobody wants to actually risk getting the flu and COVID. So take the flu out of the equation by getting a flu shot. Super simple. Everybody should be doing it at any time, but especially this year. This is something that you should be doing for you and your family. Next slide, please. So if you want to learn more about what I'm doing with COVID and some of the news I'm putting out and foods to eat, you can follow me on social at Dr. William Li, or come to my website at drwilliamli.com. I'm trying to post regularly of news that's coming out and what my views are, and trying to give people helpful tips. Next slide, please. And I just want to take this time to thank you, because it's really hard to find information that you can actually use and trust, that's consistent, that's based on science. And what I'm committed to doing is really communicating what I know to be true, that's based on science, that people can actually take actions on. So with that, I want to thank you very much, and happy to take some questions.
Fantastic. Thank you so much, Dr. Li, for joining us and sharing some of that great information. I just wanted to quickly touch on our upcoming webinars through PJRFSI. You can find a full list, including links to register for free, at our website under the webinars tab. But as Dr. Li mentioned, we're going to go ahead and get into questions. We've got about 10 minutes to get into some questions here. And we've got our first question from Joseph. And Joseph is wondering, Dr. Li, where he could find a link to the Duke University mask study.
Yes. So if you go on search Duke University mask efficacy, and it'll take you to it'll just take you right away. The Google search will take you right to that study, and easy to find. I think you can download it for free, and all those pictures and all the data is actually in there, and it's worth reading and it's worth studying. And again, this is an active area of research, and it's just good to know and be able to share with other people. I've been sharing that study and those pictures and the graphs with other people that when I've been talking about masks.
Excellent. We've got a question here from Phyllis. Phyllis is curious about what kind of mutations might have been happening in COVID, and what makes it so easy to contract.
Right. Well, okay. So there's been some news in the last few days about mutations in the virus, and those mutations. And those mutations might actually make the virus a little bit more contagious. So first of all, you got to realize a virus is kind of a pretty simple organism. It's mostly small bits of genetic material packaged together. This is an RNA virus. Not that many pieces to it, but all viruses mutate. That's just the nature of things. I mean, all cells in our body also mutate eventually. So far, there haven't been that many real problematic mutations that we've seen in this coronavirus. So that's a piece of good news. Makes it a little easier to develop vaccines and antibodies against this particular coronavirus. Now we're getting a little more sophisticated. We're tracking down, and we're realizing there's more than one version of the coronavirus that's been running around. The first one that actually came from China and came over to California and Seattle probably wasn't that contagious. It was contagious, but not that contagious. So ones that came over from Italy or Europe over to New York, that was a doozy. That virus, that genetic version, had a mutation in it that made it really, really infective. And so we've already been dealing with this really since the spring. The recent news that the virus may have some mutations is something we need to watch. I don't think it changes the way that anything that we would actually do. It doesn't change anything that's planned going on, but it does put us on notice that we want to make sure that we in the medical community and the research community are monitoring for the types of mutations that are going to occur. Why is it so contagious? Well, because it's in the air. We breathe the air, and we want to be around people. So those are really the simple reasons to wear masks, keep your social distance. And then, the hand washing is just important, because if you happen to touch a place where somebody's respiratory droplets have been, and then you touch your face, you could accidentally infect yourself.
All right, I did see a quick question come in about the recording and slides. As I said at the beginning, if you missed that part, the recording and the slides will be available from PJRFSI.com. On the mask topic still, Dr. Lee, Tom is wondering, since net gaiters are obviously poor at preventing the outward spread from an infected person, does the opposite also hold true? Is it permissive in allowing infected particles into an uninfected person?
Right. So in general, I try to tell people the masks are a two-way street. When you're wearing a mask, it makes it less likely you'll breathe in other stuff that's in the air, and it makes it less likely that you'll put stuff into the air. And so the study that was done by Duke actually looked at putting stuff out through the mask into the air. So that's sort of an expelling particle issue. So that's what that study was actually done. In terms of actually having the particles come in, I would imagine that the way that the mask is shaped, if particles can go out, they can also probably go in, although that hasn't been studied. But I would say, I guess people who have gaiters would be well advised to actually shift to, simple cloth, multi-layer cloth mask or procedure mask.
Better to err on the side of caution then.
Exactly.
All right, we've got a question from Van here regarding dark chocolate and flavonoids. Van would like to know, what's the amount of flavonoids that we should be consuming to get positive effects? And also, would something like cacao nibs be more effective than processed dark chocolate?
Yeah, well, so that's a really great question. So there have been research studies done for a super high flavonoid chocolate, which is the type of dark chocolate. And there was the research was done with a product, a cacao product called Cocoa V. It's kind of a super high concentrated flavonoid. And the study actually that showed regeneration in stem cells just had the subjects drink 2 8-ounce cups of hot chocolate made with Cocoa V. And that's how they doubled the number of stem cells in their bloodstream. So that's a good kind of measure of how much you need, which is frankly not that much if you think about 2 cups of hot chocolate. And by the way, these are 8-ounce cups, so that's not even a mug. In terms of cocoa nibs, great way of getting cocoa flavonoids. Some people can get them, some people can't. Sometimes people love them. I encourage people to try to get dark chocolate any way they can, because in addition to the stem cells, it also helps to, it's also good for our circulation, lowers our blood pressure, and also here's sort of there's a hidden upside to chocolate. It also feeds our microbiome. Our bacteria loves chocolate.
Hey, I'll take any excuse to eat dark chocolate. It's the best. We have a question here from Constance. Constance wants to know, is it safe now, do you think, to go to the dentist, the doctor, other routine medical appointments?
Yeah, so I've recently been to medical offices myself, and I can tell you that the precautions in medical offices are extraordinary. So first, you got to stay in your car and call them when you arrive before your appointment. And the reason you have to call them is because they're keeping the number of people and the traffic in the waiting rooms really, really low. So I would say that that's a sign of safety. Secondly, they're taking your temperature before you go in. So they're taking everybody's temperature, not letting anybody kind of get in further if your temperature is elevated or anything suspicious. There's signage everywhere. And of course, the medical staff is being really careful. Everybody's wearing a mask. So I think that, you should go to your doctor or your dentist if it's part of your normal health routine. I don't think you should not go to the doctor if you need to go to the doctor. And right now is a good time to go to the doctor to get a flu shot, as an example. So anybody with an underlying condition or ongoing condition that you need to see your doctor for, please go. Be reassured that doctors' offices are taking great precautions. They are in this to try to keep you healthy, and every interaction I've had with a doctor or a dentist has really been about as safe as you can get.
That's great to hear. Now, Dr. Lee, I know you have other commitments that you need to get off to. Thank you so much for answering all of these questions. Did you have any parting words for our attendees before we end the webinar today?
Well, I would just tell you that health is more important now than ever before. I think we've learned that in 2020. We want to stay healthy, and we're not waiting for. I think the other thing we've learned in 2020 is we're waiting for other people to give it to us. It's up to us to stay healthy. We are empowered ourselves to do what it takes to be as healthy as we can. So if I can leave you with one thing, which is you are empowered to make good decisions, make those decisions, be all you can be, and actually be as strong as you can be. And that's how we're going to get through this together.
Perfect. Thank you so much, Dr. Lee. As I mentioned before, everyone, the recording of this webinar and the slides will be available from PJRFSI.com. I wish you all the best. Stay healthy and stay safe out there. And thank you so much for your attendance. Dr. Lee, hope to see you on a future webinar.
Thank you.
Have a good day.